A big concern we hear is fear of surgery. Can you explain when surgery is not necessary and why watchful monitoring is often the right approach?
Well, when a patient is thought to have a benign nerve tumor, that patient's usually minimally symptomatic. Now, that's not always the case. I mean, there are definitely patients that have benign nerve tumors that are big, they bump into them, they're very symptomatic, but most of the time that's not the case. And so patients that had this new lump in their arm or leg or body, and they're not really bothered by it, there's a lump and it doesn't really hurt, it doesn't really bother them, they don't really see it, they feel it once in a while. A patient in that circumstance, we probably wouldn't offer surgery. If the patient, for whatever reason, really wants the tumor out, then that's a different story. We'll, obviously listen to what and try to accommodate the patient's desires. But I generally encourage patients to not operate on tumors that aren't misbehaving. What I mean by misbehaving is they're not causing the patient a lot of symptoms. They're not growing rapidly. They're not in a technically complicated area that would make it hard to take them out if they were to grow. And if they're behaving in a benign fashion. So those, I have a lot of patients where we just get an MRI every year or even every other year just to demonstrate that the lesion's not really changing much. And we just watch it. Because a lot of these tumors, they stop growing or they grow so slowly that, over the course of a patient's lifetime, they'll never need to be taken out. And so that's what I would do as a patient. If I had a tumor that wasn't bothering me, I'd leave it alone, But if the tumor starts growing faster or starts to become painful or starts to stick out or I really start bumping into it, then that's a different conversation. Then we start to talk about, well, here are the risks of surgery, and then we can start to make some surgical decisions. But ultimately, it's going to be up to the patient. I never push patients into having surgery. They don't really want it, and I try not to, I try not to be too aggressive about talking patients out of surgery. Not that I just do anything that the patient wants, but we have that conversation. It's a back and forth. And if a patient really, really wants to have a tumor taken out, patients have good reasons for things, and then we'll have that conversation.